My name is Sheree Wertz. I am a dental hygienist. I've been a dental hygienist for 33 years, and I am also an oral health coach, training moms how to take care of their children's teeth to prevent cavities, gingivitis, and gum disease, and ultimately help keep their body healthy, because your mouth is connected to the rest of your body, and it can also not only prevent dental disease but also prevent oral systemic diseases. It can prevent diseases like diabetes, heart disease, kidney disease, low birth weight, preterm delivery, and other things that are connected to your body health. So I am very passionate in helping children, mostly because when I was younger, I had high fevers, and in the 60s, which is when I was a baby, they gave kids tetracycline, and they did not know then that that tetracycline caused staining on your teeth. So if you were a baby in the 60s, you probably have gray teeth if you had to have tetracycline. And when I became a teenager, I had kids tease me on the bus, and they would ask me if I knew how to brush my teeth, and one boy in particular called me crusty. And so I dreaded riding the bus home, and there were days that I would cry because kids would point and not want to sit with the girl with the dirty teeth. And so when I got old enough, I was able to go to a vocational center where they had dental assisting school while I was in high school. And it came very easy to me. I am dyslexic. I struggled with school, I struggled with reading, but dental assisting and the instructor that I had was amazing. And it was the first time that I actually liked something about school. So when I graduated from high school, I became a dental assistant and worked with a doctor. And from there, I became a dental hygienist. And I saw the need and that I could make a difference in helping other kids not have the shame that I felt and how I felt about my teeth. My dream is to educate parents about the oral health, your mouth, how it's connected to your body, and that oral disease and dental disease is 100% preventable. I think that we talk a lot about diet and exercise and being healthy, but we don't talk about how your mouth plays a role in your overall body health. And we put foods into our mouth. We eat. A lot of us breathe through our mouth. And so all things happening through your mouth go through your body. And my goal is to educate people that dental diseases are 100% preventable with just 3 things. And if you know that and you take into action those things, ultimately, my goal is to reduce the number of kids that have cavities and gingivitis and ultimately gum disease, and then hopefully prevent some illnesses that could possibly be prevented by taking care of your oral health and having intention in brushing your teeth. When you understand that, it just makes a difference in your whole life and helps you be healthy. So as a dental hygienist in my practice, when I am educating, I have people say, why didn't someone tell me this before? And I really don't know the answer to that question, except for sometimes in a dental office, we are there to treat disease. So we take care of what's presented in the time that we have. So whether we have 50 minutes or an hour, we're just trying to clean plaque off of people's teeth. And so as a dental hygienist, I'm seeing that people are saying they're brushing their teeth, but that plaque is still on there. So I think that if we can get the plaque off and get people to understand that what they do at home between dental visits is really important. There are steps that you can take in between the 6 months or a year when you see a dentist. And dentists are really there to diagnose what you have in your mouth and then treat any things that you have, and then just have you come back for preventative appointments. They're not always there or have the time to educate you. So that's why a lot of people haven't heard a lot of these things. And a lot of this is new in the research from studies that they've shown. Bacteria that they find present in the mouth is now present in the body when they're looking into it more. So the research has just come together in the last couple of years of how the bacteria in your mouth is affecting the rest of your body. So we're just more aware now. I had started this healthy mouth movement probably about 10 years ago, and I got a divorce and had to get a job, and I was now a single mom. And my uncle had diabetes, and I was seeing him, and I saw him over the years of seeing him lose a tooth here, lose a tooth there, and have gum disease, and sent him to the doctor to have blood work done. And he came back and said, no, nothing's wrong. And probably about 2 years later, back to the doctor, was diagnosed with diabetes. And still could not get his gum disease under control. We were doing deep cleanings and cleaning his teeth. And I just watched the progression of the disease. He was a heavy smoker. He was a reformed alcoholic. And all that stuff is just hard on your body. But probably about 5 years later, he was diagnosed with a rare form of cancer. And as a dental hygienist, seeing this over and over again, people get diagnosed and not seeing a pattern. It wasn't until I just was starting to work with people that they were talking about patterns that I started to see that there wasn't just him as a pattern, there were other patients that I have. So I started gathering all of these case studies of people that I had sent, and they said no, everything was fine, and then years later they were diagnosed with something. So my goal is to get people to understand that going to the dentist is not just about getting your teeth cleaned. It could save your life, and that you have to be your own advocate. And then if you know that you have disease in your mouth and you've had the deep cleaning and you've followed everything that your dentist says and it's not getting better, and you just keep seeing this disease progress, that maybe you need to find someone that can help you find out what is the cause of your gum disease. Because what I've seen in my 30 years is that it's usually more a sign that something is out of balance in your body, but you just have to figure out what that is. And sometimes it's not easy to find. And it's not until later that people were diagnosed. And I know it chokes me up because part of me feels like maybe if I had been more vigilant and believed in myself that I wasn't crazy, that everyone was telling me, no, it's not true, it's not related, that maybe I could have saved his life, or maybe I could have saved other people's lives. And I know dental hygienists that have made a difference and have found things. There was one lady that I sent her and they found thyroid cancer, and she was able to get that treated and she is still alive. There are a couple other people that are not alive, and it wasn't until after people died that I started to connect all of this. So this is why I'm passionate about the healthy mouth movement, because it's not just about your teeth. I have to do this now because when I sleep, it doesn't go away. I dream about things that I can do to help people, and I hear this voice telling me that the world needs what I have to offer, and that if not me, who? So I am just following that, and I tried to quiet it. I tried to just be happy with where I am. I've had people in my life say, why can't you just be happy with what you have and what you've created? And I don't know why. I think some of us are just called to do things, and it's in us, and there's no explanation to that. I just know that it just keeps calling me, and it wakes me up at night, and I have to wake up and write things down and just present them. And so that's why I just started doing videos probably about a year ago, just to start educating people and be comfortable in front of the camera. But I just know that there is a need, and I guess if not me, who? So this is why I'm doing it. The most rewarding part is seeing that I made a difference. The lady that had thyroid cancer, when she came back and she gave me a huge hug and said, if you hadn't have told me this, we might not have found it soon, and you saved my life. And it's not just me, I've seen other hygienists. There was a hygienist in a Facebook group that I'm in that was cleaning someone's teeth and found a melanoma on the top of someone's head, and it ended up being cancer. There are younger kids now that we're doing oral cancer screening. Oral cancer used to be that you had to have risk factors like smoking and drinking. And now with the HPV virus, we are seeing oral cancer in teenagers and kids in their 20s. And because of oral cancer screenings, we're catching that sooner. Oral cancer has a high fatality rate because by the time we see it with our own eyes, it's in a stage 2 or 3. But with some of the early detection screenings, the lights that we use, we can see the cells mutating below the surface with a light that we use. And it was just about cleaning teeth before, and now it's more than that. It's about saving lives and making a difference. And now instead of prevention, or instead of treating disease, I decided that we needed to talk more about prevention, because dental disease is 100% preventable, and that's what I want people to know, is if they take action, they don't have to go through some of the things that I've been through in my life, because they started early and they used the tools that they have to prevent disease. So if my perfect client comes in, you probably need to know that dentistry is all about mindset and what is important to you. And so by telling people what's going on in their mouth, I'm hoping that I get to them before they get to the dentist, because fear is the #1 reason that people don't do things. And fear can come in many forms. Fear that because you had a bad experience, fear because you're ashamed that you haven't gone to the dentist in a while and that's what keeps you away, fear that the dental hygienist is going to tell you that you need to floss and you don't want to floss, fear that you're going to have a cavity or you're going to find something and it's going to be costly, or you're going to be in pain when you're not in pain. So my ideal client would be to be open and trust the process, and that what we're telling you is to help benefit you, and also be your own health advocate. You don't necessarily have to trust what I'm saying. Maybe take what I'm saying and go Google it, check it out, see if what I'm saying is true, and go by what resonates with you. I know from personal experience, if somebody says something to me and I get angry about it, then it's either not true, I'm not believing it for myself, or I believe it to be true and I just don't want to hear that information. So if somebody tells you something and it gets some kind of emotion for you, then it resonates with you somehow. So you either don't believe it and have to find someone that you trust, or you need to research it and just figure out what is the next best move for you.